So regarding the surfaces of the clavicle, we have got two surfaces. One is the anterior surface and the other is called as the posterior surface. So when you talk about the anterior surface, that's also called as the ventral surface, and it's somehow related to the bony thorax and the costal cartilages and the rib cage. Then you have the posterior surface, which is related to the vertebral column. So when you talk about the anterior surface, you have somehow thicker parts of the scapula, and then you have some thinner and depressed parts of the scapula. So you have the acromion, which is most of the time, making articulation with the clavicle, which is the acromioclavicular joint, and it's the you can say horizontal forward broad extension of the spine of the scapula, which is located posteriorly. Then you have the coracoid process. So the coracoid process is attachment for many of the ligaments, like the coracoclavicular ligament, and these ligaments like the acromioclavicular ligament and coracoclavicular ligament, they're responsible for maintaining the stability of the shoulder joint. And whenever these they are injured, or their insertions are being displaced, then they result in to posterior or inferior or anterior dislocation of the shoulder joint. So then you have the suprascapular notch for the passage of the suprascapular nerve, and then you have this depressed superior surface, then medial border and the lateral border. And at the center, there's a triangular depressed part, which is called as the subscapular fossa. And the subscapular fossa is the thinnest part, and it's depressed as well, it's flat as well, and it's a site for detachment of the subscapular muscle. So subscapular muscle is the important part of the intrinsic muscles, which there are the rotator cuff muscles. So we have supraspinatus, infraspinatus, teres minor, and subscapular muscle, which are called as the rotator cuff muscles of the shoulder joint. Then you have the posterior surface. Okay, so posterior surface is related to the vertebral column. Then you have the spine of the scapula. So you can see here, this is the spine of the scapula, which is projecting from medial to the lateral end. So this is the medial border, this is the lateral border, and it's crossing the glenoid cavity, and it's making acromion towards the lateral border, and it's attaching to the clavicle, which is the acromioclavicular joint. And this spinous process of the scapula, or spine of the scapula, is dividing the posterior surface into upper and the lower part in unequal portions. The part above the spine of the scapula is called as the supraspinatus fossa. See? You can see here, the upper part is supraspinous fossa. And the part below the spine of the scapula, that's called as the infraspinous fossa. So these fossas are important because supraspinatus muscle is attaching to the supraspinous fossa, and infraspinatus muscle is attaching to the infraspinous fossa. So these are the important parts which are on the anterior surface and which are on the posterior surface. Remember, the scapula is extending from second to seventh rib. So this inferior angle and the spine of the scapula, these are the two parts of the scapula which can be palpated individually by a person. So the anterior surface has got the subscapular fossa for the attachment of the subscapularis muscle, which is a part of the rotator cuff muscles. And then you have the spine of the scapula at the posterior surface of the posterior surface of the scapula, and it's dividing it into two parts: the supraspinous fossa and the infraspinous fossa. And the supraspinous is for the attachment of the supraspinatus muscle, and the infraspinous fossa is for the attachment of the infraspinous muscle. Okay, so if there is injury, or you can say there's a condition clinically which is called as a rotator cuff tendinitis, and there's inflammation of the tendons of the rotator cuff, and the patient will present to you with the restriction movement of the shoulder joint, and there would be pain, and that typically is in layman language that's called a frozen shoulder, but that's rotator cuff tendinitis, frozen shoulder, rotator cuff syndrome, rotator cuff tear. These are all names of the same pathology and the same presentation. So remember the anterior posterior surface, their fossa, their attachment of the muscles, and their clinical implications.